We are here from 360 Critical Care. Welcome all of you. And today, why we are gathered here? Just to know about the pattern as well as the recall questions those were asked in the recently concluded EDIC 2 exam. And we are here to help you what was actually asked and what we gathered the information or feedback from our like the trainees and also many of the trainees that this time the questions and the process was really very difficult to like tackle and they were little bit like stressed out during the exam. Post exam also many of the candidates have written personally that yes they were like waiting for the result so eagerly. So what would be happening and how the exam result would like come. So definitely it is very unpredictable this time. So that's why last time also we have decided to go ahead with this time of recall like webinar to know about the exam pattern, the questions from our like trainees. We have collected the questions, and that's why this year also this was the consensus decision by all our faculties from 360 Critical Care. And here we are having a free webinar, and this is a very unique initiative from 360 Critical Care Online Academy. This is the academy which has started this EDIC2 preparatory course 4 years back. So it is almost right now ninth the EDIC2 preparatory course we are about to conduct, and one of our trainee, Dr. Niharika, she is now the faculty in our this the Tricks 2 course. So welcome Dr. Niharika to
Thank you, sir.
the Tricks 2 preparatory course, and with us also Dr. Jitendra C. He is a consultant critical care medicine from Apollo Specialty Hospital, Bengaluru, India. He is a very, I would say, widely like a very revered teacher and faculty from our Tricks 2 course. And with us, I am so glad to welcome Dr. Kirlos Nasim. He is a dear friend and also a very popular teacher, I would say, mentor from Nasser Institute Hospital for Research and Treatment, Cairo, Egypt. He has like the website. He has his own page, which is helping the candidates to crack different like critical care examinations across the world and also in the Middle East countries. Dr. Kirlos is joining soon, or like I don't know, he has joined because it was like Eid yesterday, so he has posted that he is about to join. Now with us also Dr. Sanant Kumar Das, who is the one of the course director and also consultant intensivist from Australia. So welcome Dr. Sanant to this preparatory free webinar course, and myself Dr. Tapas Kumar Sahu from India. Now, why we thought about like having this type of recall webinar session? Because everybody seems to be stressed after this May 20 EDIC 2 exam, including the examinees, including the people who are thinking to again appear the upcoming sessions. So that's why we thought maybe a recall webinar and a course which would be something which will be bringing to all of you. Now, before that, why is EDIC 2 becoming increasingly difficult and also challenging from year to year? Now, we have thought about it, we have analyzed, and we came to the conclusion that yes, there are certain regions, certain like points that we need to remember. Evolving question formats. Now, the question pattern or the examination is moving beyond the traditional knowledge testing to complex interpretation based CBS and CCS stations requiring higher order clinical reasoning. This is one of the main reason. Now, maybe before 5 years, it was not that very much extensive or like comprehensive exam. But today, if I would be analyzing from the feedback of my own trainees from our academy, so definitely they are saying that yes, the scenarios they are now providing in the exam, maybe in the CCS or in the CBS, they are complex. They're not so simple to analyze and crack. Unpredictable domain selection. This is the second one. We have got the feedback that the candidates often face unexpected combination of topics and niche critical care scenarios, making targeted preparation difficult. So whatever we are preparing, maybe the examiners have actually thought about something different. So that is also one of the thing. Every session, every year, the examination is becoming more and more unpredictable. Now, the third one is unclear scoring methodology. Now, this is something we as like from outside we cannot comment upon, but the marking scheme and the weighting of responses remain largely it is completely confined to the EDIC examination committee. Now, this creates uncertainty regarding examiner expectations. Maybe we are thinking that we have answered it well, but the examination pattern or the options that they have selected may not be as per our expectation. Now, rapidly expanding critical care evidence. Now, the guidelines, the technology, monitoring tools, and the therapeutic approaches continue to evolve rapidly, making it challenging to remain fully up to date. So, that is something also now very challenging for the trainees, for the colleagues to be always updated what is happening at the national and international level. Now, the breadth versus the depth dilemma. Now, the vast syllabus are actually spanning multiple specialties. It is not the core critical care. It is also entering into nephrocritical care. It is also entering into detailed cardiovascular critical care, maybe respiratory critical care. So that makes the revision very comprehensive and be master of every domain is actually increasingly difficult. You all will agree with me. Definitely. All the faculties will also agree with me. Now, the last point that we have thought about is difficulty decoding the examination pattern. Now, this I would be rating the number one now. Why? Many candidates struggle not because of lack of knowledge. They know critical care, but because they are unable to identify the examiner's thought process. Prioritization strategy. What would be the first answer, the second answer, the third answer? Maybe you all know it, but how to actually structured wise answer it in the that 2 hours, 3 hours of the examination or the time period. That is something I would say is the most difficult to crack. So cracking the code is I would be naming or rating as the number one reason the examination is becoming so unpredictable. Now, the second point I would say, as you can see here, it's not about working hard. Rather, I would say working smart would be the answer to crack this type of highly competitive and the challenging exam like EDIC 2. Now, with this, I would be definitely bringing here the tricks 2 course, which is here for the all fourth year running. We are entering into the fifth year, and this course is about whatever the candidates actually expect. We every year we thought about how to improvise it, and this time also we have already formulated our plans, and I would be sharing the details about the course structure that we are bringing very soon after we discuss about the CCS and CBS questions those were asked in the recently conducted 2 sessions. So I would not say only the last one May 20, rather the previously also the November session of 2025 also we have included the questions those were asked. So it is a two these sessions of EDIC 2 questions we have gathered, we have accumulated, we have curated, but a disclaimer from our side, these questions are no way directly copying the EDIC 2 questions, and definitely these are the highlights of the examination, or I would say the more or less I would say the trend of questions we have captured, and these are the recall questions. So no way it is just to confirm you that these are the exact questions those were asked in the last 2 sessions. Now with this I would say we have to find a pattern in the EDIC 2 examination, and that's the code what I have mentioned in my last point. So thank you very much.